I rise before this August House and support the 2021-2022 budget announced by the Honourable Minister of Economy and the Attorney General. And I want to congratulate the Honourable Minister of Economy and his hard-working team at the Ministry of Economy, the Acting Permanent Secretary, and the three gentlemen that work hand in hand with him every day. And in terms of preparing the budget, but more importantly, in terms of the ongoing working with our ministry during this difficult time, ensuring that we are properly resourced for the fight that we have at hand. I thank the Honourable Prime Minister and the Honourable Minister of Economy for allocating $403 million to enable us to deliver our role as a ministry and as a health service provider for 2021-2022 budget year. This, Honourable Speaker, in a time of challenges not only within Fiji but also worldwide. Many nations are facing the economical challenges of COVID-19. Many nations' budgets have been reduced. Many nations' economy has been depleted. And in the midst of all this, I have witnessed in my meetings many countries who have had their budgets in the Ministry of Health reduced. We are one of those countries where our Ministry of Health budget has actually been increased in the midst.
Here.
And this shows the investment, and this shows the compassion and the care that the Honourable Prime Minister has towards the people of Fiji through the Ministry of Health. Our objectives in this budget are threefold. One is to continue the complex, and I say complex because this is a word that one of the specialists from OSMET, and also this is a word that's coming very clearly from our discussions with WHO. And this is a word that's coming very clearly from development partners that are working with it. This is a complex, well thought out response to COVID-19 and to fully vaccinate our people. That's our first objective. Our second objective is to continue to strengthen our remodeling exercise based on the universal health coverage on Sustainable Development Goal 3. We want to continue to reach the unreached and leave no one behind. We had begun on sending out outreach teams, on making sure that we're able to hold clinics in isolated health centers, and also enabling subdivisional hospitals to be used as tertiary secondary level healthcare facilities. And in this time of the outbreak, this preparation has been very useful to us. We've been able to switch a health center into a place where we can be able to admit patients, such as we've done with Waqainabete. And thirdly, we want to continue to strengthen our health system. So at the end of this, we have developed a resilience dividend, which means that we are making health gains. We remember and extend our sincere condolences to the families of those lost to COVID-19. And within my own family too, we've had our own losses. We've also lost frontliners, and I thank the many frontliners, including the discipline forces and civil servants and the many organizations that have worked hand in hand with us day and night. And their resolve is exemplary. For every 99 good things that they do, only one is put up in social media. And that seems to be the reason why the frontliners are not doing their part. Just one event. And we keep on encouraging them that Fiji is indeed grateful to the work that they've done. Honourable Speaker, at this point, when I was reading through and trying to make sense of why people would attack our frontliners on social media and so forth, I read with interest a quote from somebody, and he says like this, that the keyboard is a sword for the weak man. And I realized that criticism comes from a place that is different to what the general Fijian wants. The general Fijian wants to be able to be protected and looked after by the frontliners, and the frontliners will continue to do their part. In the 10th of March 2009, this year, we introduced COVID-19 vaccines. And we began with a gradual uptake from April to a much broader vaccination program. And again, I express my dismay at the anti-vaccines, including members of this parliament. For our data clearly shows that nearly 90% of our deaths are the unvaccinated. The rollout that we have now is on track to achieving greater than 80% of the age-eligible population. And I urge us to all keep on pushing so that everyone is able to be vaccinated. And if we can achieve near 100%, even better, because we have enough vaccines to do so. To date, as of this morning, we have vaccinated 449,934 first doses and 103,742 second doses, which accounts to 76.7% of Fiji's population having received their first dose and 17.7% having received their second dose. Honorable Speaker, also today, it was heartening to see the rollout begin in Lakemba and also in Mamanuca and their Sawas. And this has also been able to happen because we have partners, many partners that are supporting us, such as Sea Mercy from New Zealand, who took the vaccines up to the Mamanucas and their Sawa, and Air Mango, who took it up to Lakemba. The Central Division has received 76.7% for the first dose and just a little under 16% for the second dose. Western Division is doing very, very well, and I congratulate our Western family for having achieved more than 84% of the first dose and 24% for the second dose. Northern Division, 67% for the first dose and 10% for the second dose. And in the Eastern Division, at 38.5% for the first dose and 6.5% for the second dose. But because of the small populations, we believe that this will be quickly covered in terms of the first dose. Honorable Speaker, I remind this August House that being fully vaccinated by 2 doses and a further 2 weeks after engages the maximum protection. That is why we have the fully vaccinated then move policy that we have in place that my Permanent Secretary had read in his statement. And that is also why Honorable Siri Randrondo, for our Highland people with some distances between their homes and our healthcare facilities, this is the time to achieve as much vaccinations as a protective measure. As I've stated before, nearly 90% of those who passed away are unvaccinated, and just a little over 10% have been partially vaccinated. This is in keeping with the Public Health England report, which came out nearly a month ago, which showed that 92% of those who've been fully vaccinated are protected from hospitalization and a higher percentage from death. Honorable Speaker, full vaccination is a lifesaver. To date, we have confirmed enough vaccines for all age-eligible children, age-eligible individuals, and continued dialogue for securing vaccination for 12 to 18 years of age when it becomes acceptable and meeting the WHO criteria. We note that the European Union has made recommendations on this recently, and we are on track to have all the fully vaccinated age-eligible individuals and enough vaccines to be able to reach out to our children less than 18 years old when that guidance comes through. I call on everyone and encourage everybody, those who have vulnerable conditions and those who don't, but who are over 18, to come forth for vaccination. We now have Moderna, which has 28 days interval between doses, and this is specifically for our mothers and the vulnerable population. Honorable Speaker, as of 8 a.m., 26th of July, we've recorded 24,400 positive cases. And we continue contact tracings where possible, and this is undertaken through face-to-face interviews, follow-up phone calls, and through the use of Care Fiji app. There's been 2,800 cases in the Western Division. In the Northern Division, there were 5 cases, which have all come through the local repatriation program, and these cases have recovered. For the Eastern Division, there were 12 cases reported, but all have recovered. And for the Central Division, 20,459 cases were recorded for this current outbreak. Honorable Speaker, we have introduced some strategic and innovative changes in the operations in the Central and Western Divisions, which includes operationalizing a robust clinical monitoring referral system for all cases of concern. We've established and consolidated intermediate care facilities and optimized the human resources and supplies such as PPE that expand our bed capacity for ICU. We have enough PPE. We noted that there was issues with delivery of PPE, and we've made sure that this has been attended to. This also included the expansion of functional and staff beds at intermediate care sites, to manage over 200 cases. The Lozala Bay Complex, Sports Complex, is a wonderful asset, and I thank the CEO and her board for the indulgence. And this includes also a centralized retrieval system run by FIMET and includes members of the VFR, Discipline Forces, St. John, and all these expansions that we've done have specialists in charge. And these specialists are the physicians, surgeons, anesthetists, pediatricians. They are in charge of all our extensions and our optimization that we are doing all across the Central and the Western Division. Honorable Speaker, I have been in this health system for more than 20 years. And I can tell you, Honorable Speaker, if we had faced this calamity 15 years ago, when we had only 300 doctors and under 2,000 nurses, and much less oral health, allied health, and other resources such as vehicles that we have. And on top of this, if the salaries were reduced like the opposition has kept on asking, we would have surely collapsed. At this time, 15 years ago, we only had a few specialists. I was just a very young specialist. And the Honorable Dr. Mbalavu had just begun his career. Of course, at this moment, we are stretched. And yes, there are occasions when things such as isolation facilities, use of tents, the use of container refrigeration is not normal to us. But this will pass. If we adhere to the public health safe measures, if we become fully vaccinated, and those numbers keep on rising as quickly as possible, the number of cases will decrease and the deaths will stop. We only have to see what's happened in the US, in the UK, in the European Union, even in Israel. Even in Israel, vaccination does work. Vaccination prevents the huge transmission of disease, and vaccination does reduce the death within Israel. And I'm saying it with interest because one of our honorable members continues to talk about Israel. Honorable Speaker, task shifting, especially in the Central, now has allowed us to focus our clinical teams on clinical roles, while the role of information management and remote monitoring is being managed by mostly non-health staff under the supervision of health staff. And at this juncture, I want to thank the many civil servants that have been seconded and have volunteered to come and work with us. They have been very useful and they've brought their expertise. Teachers, lawyers working through the SG's office, people coming through the Ministry of Economy, drivers. These are all part of our frontliners. And they've brought the expertise to support us because the Honorable Prime Minister has made it very clear that this is a whole of government and a whole of nation approach. Honorable Speaker, we have to keep reminding ourselves of and by doing so, the ministry continues to conduct training on virtual platforms on key issues with our health workforce through our SOPs, our care pathways, our strategies, because whether it's the Delta or other variants, we have to know what's the best practice. This Delta variant, as we all know, is more transmissible than the beast that we had last year at this time. It's more transmissible. And it's so important. Every week, I've been part of this. Apart from the meetings that happens in the morning, in the evening such as this, as we speak, there are doctors and nurses and technical staff that are on virtual platforms throughout the country, sharing best practice, talking about what needs to be done, talking about journal articles, learning about what we can do as a ministry to continue to fight and overcome this difficult challenge that we have. Honorable Speaker, in this budget, 25 million is a contingency fund for COVID-19. And we will use this contingency fund as needed. And during this present budget, the contingency fund that we have in place has been well used for the many strategies that we have. Honorable Speaker, this 25 million will be available for whatever the next curveball COVID-19 wants to throw at us. Honorable Speaker, I want to bring to this House's attention that on the 12th of July, the Public Health Amendment Act came into force, which spells out legal responsibilities to support the collective effort towards controlling and stopping COVID-19 outbreak in Fiji. It is imperative that we promote COVID safety measures so that we can bring this outbreak under control. In order to do that, there was amended legislation. I'd like to thank the Ministry of Commerce, Trade, Tourism, Transport, municipal councils, FCC, and the police officers who are enforcing the COVID safe regulations. Under this amendment, fixed penalty offences have been gazetted for around 23 offences, which carries fixed fines ranging from $20,000 to $4,000. Mr. Speaker, I thank these agencies, and in particular the Fiji Police Force, for their efforts and dedication towards keeping the law and order and ensuring that COVID-safe measures are enforced. Honourable Speaker, in the first week, the police team conducted 556 bookings. Of these, 245 bookings were related to face masks, 89 bookings were in relation to public service vehicles, and 69 bookings were gathering offences. Honourable Speaker, I sincerely hope that these bookings will reduce, because it will show that we are continuing to embrace the COVID-safe measures. Honourable Speaker, Digital Fiji is also assisting us in setting up online payment systems to avoid queuing and unnecessary contact other payment systems like M-Pesa or MyCatch. Internet banking, direct transfer deposit have also been activated. Honourable Speaker, human behaviour can be influenced by several factors, ranging from the use of media, communication, and behavioural response in infectious disease is shaped by a combination of all these influences. And it is hope that with the use of infringement notices, we can be able to strengthen our need for COVID-safe behaviours. Honourable Speaker, in relation to the vulnerable groups, which is people with NCD, elderly and the disabled, on this subject, the Ministry in this 2021 budget will continue to support them, those living with chronic disease, those with compromised immune systems, older people over 60 of age, children, women, and in particular pregnant mothers, people living in geographically remote areas and unvaccinated. The Ministry has developed targeted messaging for people with comorbidities and pre-existing conditions. National and community-based vaccination drives has included drive-through vaccination programs, targeted vaccination for pregnant mothers with the Moderna vaccine, and home vaccination for the elderly and physically disabled. Continued advocacy on public health measures, including social distancing, restriction of movement, hand washing, appropriate masking. With the support of health partners, the 165 helpline was implemented on 19th of May in the Western Division and 26th of June in the Central Division. The line receives an average of 8,000 calls per week. We've also been working with the Fiji Sports Commission to get targeted physical activity measures specified to various age groups. Using National Food and Nutrition Center and other social media platforms to advocate for COVID-safe measures, virtual training with the Minister of Youth, Sports, and also active involvement in the UN Food System Summit to ensure policy changes and reflections of transformations needed for food and nutrition security. Honourable Speaker, the Ministry is working also with NGOs such as MSP, Fiji Cancer Society, to name a few, Diabetes Fiji, and as I alluded to earlier, also working with the Fiji Sports Commission. Honourable Speaker, our public health programs on communicable disease prevention, the National Center for Health Promotion, pollution control, climate change, and healthcare waste management, and food safety, to name a few, range from 20,000 to 200,000 in this 2021-2022 budget. These programs are vital in advocacy and health prevention and protection. All our divisions also have provisions for outreach programs. Honourable Speaker, $2.5 million has been set aside for many mothers and women who are our community health workers. I've been proud also to have met a growing cohort of male community health workers. Sir, these community health workers have been part of our frontline response, and I thank them, and they are a great asset in every community. Honourable Speaker, we will continue in this budget to support our mental health and psychosocial support, which is a priority of the Ministry of Health and Medical Services. We've decentralized our mental health services closer to the community a few years back, and we work with NGOs such as Empower Pacific and Medical Pacific in providing support to those who might need psychosocial support. Once we have stress management wards in the 3 divisional hospitals, St. Giles Hospital has been recently undergoing further renovations to a tune of nearly $1 million. Patients in rural settings are able to be seen in our remote facilities and access treatment and services, including free counseling services. And these will continue, Honourable Speaker. Honourable Speaker, the health system continues to receive in this budget more than 100 new medical interns, 140 medical officers, 138 nurse interns, and 43 midwives to boost services across our 4 divisions. The recruitment of this additional staff, doctors and nurses, will definitely assist with managing the COVID-19 crisis. They will be strategically posted where there is a critical need within the health system. And we also, of note, is a training budget for doctors that is now at 776,000 in this new 2021-2022 budget, increased by 300,000. And this will see us training more specialists, but also training in areas that are specific to what we currently don't have at the moment. Honorable Speaker, we've also throughout this COVID-19 pandemic have used telehealth as a means in which we could engage with our patients and ensuring that we meet the COVID safe protocols. Since we've been doing it since the onset of a COVID-19 outbreak using Helpline 165. We also have a teledentistry project, which is started in Singatoka in May, teledermatology for those with skin conditions, telehealth services, telemedicine NCD, and SRH telemedicine through UNFPA, and these are there are other potential telemedicine initiatives. Honorable Speaker, what is also being used is a virtual platform such as Zoom and Viber groups to be able to reach out to patients and provide clinics, and also online prescriptions so that they can get medicines from the nearest facility. Honorable Speaker, 16.1 million has been allocated to capital construction works for the ministry, which includes major refurbishment and maintenance of health facilities. 562,000 to upgrade and maintain urban hospitals and institutional quarters. Honorable Speaker, CWM Hospital Air Conditioning Unit remedial works of 250,000 has been set aside. Honorable Speaker, 270,000 has been set aside and allocated for maintenance of subdivision hospital, health centers, and nursing station. There's a continuous maintenance program planned in the beginning of the year to maintain the health facilities in both urban, peri-urban, and rural areas. Other funding includes the CWM new hospital maternity unit of 7 million. And the next phase, the land stabilization and refurbishment of Sub Hospital, $1 million. The upgrade works at $2.5 million in La Paz Hospital. And the upgrade of Lotok Hospital Operating Theatre of Excellence Department of $1.1 million that is left, and the final payment that we are making to the CWM Emergency Department. Honorable Speaker, 11.4 million has been allocated to capital purchases. The purchases of the new boiler at CWM. Honorable Speaker, the laundry services that have been outsourced in the security services. And there are many more that are to hand. Honorable Speaker, government continues to look at the most effective means of treatment of medical clinical waste to prevent any harm to the environment and our health in general.